Listeners and viewers, God bless you all. I'm standing here to discuss my paper because of virtual international conference on advancement in research and education, which was organized by Association of Global Researchers, Andhra Pradesh, and Association of Indian Biologists, Tamil Nadu. The topic of my work is histological effects of tamsulosin in kidney rats, and the authors are Yusuf Sarkin Gobir and Malamidiko. The presenter is Yusuf Sarkin Gobir from the Department of Biology, Shehu Shagari College of Education, Sokoto, Nigeria. As I said earlier, the topic is histological effects of tamsulosin in kidney rats. Introduction. Presently, we have a very significant and prevalence of a condition known as benign prostatic hyperplasia. Benign prostatic hyperplasia is a condition or a situation whereby the prostate gland of men become enlarged. When it becomes enlarged, it may further lead to a group of symptoms known as lower urinary tract symptoms, abbreviated as LUT. These symptoms include low urine stream, stress in urination, strain in urination, pain in urination. Sometimes benign prostatic hyperplasia may lead to blockage of the urethra, which may ultimately lead to kidney failure. And this BPH and its associated symptoms, that is LUTs, are very prevalent among men as I speak, among older men, people ranging from 40 years and above. For example, it was reported that people that are 60 years have 60% prevalence of BPH or its symptoms, while in people that are 80 years of age, the prevalence rate of BPH and its associated symptoms is 80%, meaning 80% of the population have that condition or its symptoms. So because of this, a drug was developed to cure this kind of problem, and relieve the smooth muscles of the bladder and around the prostate gland so that the situation is reverted. This drug is known as tamsulosin. And we know before a drug is approved, there are some studies, clinical trials that are carried out, but unfortunately, those clinical trials and studies mostly involve a portion of the population. As time goes on, anecdotal studies are required to accumulate the adverse reactions associated with a certain drugs. That is why many drugs are withdrawn even after approval. So because of this, that is why we try to carry out this study to know what are the effects on the histology of the kidney treated with tamsulosin, a drug that is used for treatment of benign prostatic hyperplasia or lower urinary tract symptoms. To ascertain, so the main objective of this study is to ascertain whether the drug tamsulosin, which is an alpha-1 adrenoceptor antagonist, to ascertain whether it exerts histological effect on the kidney, considering the importance of kidney in the biological system. We know it has many importance. It has diverse functions such as ultrafiltration, selective reabsorption, excretion of waste materials, osmoregulation, and formation of urine, which is the overall function. So kidney has very significant role in the biological system. That is why this study is carried out to know whether tamsulosin has histological effect or not in rats. So materials and methods. 40 albino rats were selected and grouped into 5 groups. One of the groups, the first group was treated with distilled water. The second group was treated with a positive control carvedilol drug. The third group and the fourth group were treated with tamsulosin. That is the subject of contention, the subject of the study, the drug of the study, with different concentration. The first one is 12 microgram per kilogram, and the second one is increasing concentration is 40 microgram per kilogram. So histological study or examination was carried out based on standard procedures and methods reported by Dicko et al. 2019 in his PhD work. The result of our study can be seen here. Table 1. The result of our study can be seen here. Table 1 is showing the effect of tamsulosin on kidney at 6th week. After 6th week of treatment of the said rat, this is the result. So when it is the group 1 treated with normal control, that is distilled water, the kidney is normal. That is, the morphology of the kidney is normal. While those treated with positive control, 90% of them, their kidney is normal. 90% their kidney is normal. It is only 1% that resulted in, that presented with inflammation. While tamsulosin, when it is treated with tamsulosin, the kidney structure is normal. When the dose is increased to 40 microgram per kilogram, the kidney structure is normal. While here we can see table 2 showing the effect of tamsulosin on kidney at 8 weeks of treatment. So the normal group, which was treated with distilled water, the structure of the kidney is normal, while the second group treated with positive control carbidiol, 800 microgram per kilogram, the structure of the kidney was normal. It is normal. While the third group treated with tamsulosin, 12 microgram per kilogram, the structure of the kidney is normal. And the last group, that is when the concentration of tamsulosin was increased, the structure of the kidney was also normal in 90% of the rat. In 90% of the rat. Because after treatment, the rat were slaughtered. When they were slaughtered, their kidneys were removed. When they were removed, they were examined. When they were examined, this is what the result is showing. This is what the result has shown. As we can see from this picture, we can see that the Bowman's capsule is there intact. The capsular space is there, so there is no inflammation. In the second picture, that is in the kidney treated with tamsulosin at 6 weeks, we can see the Bowman's capsule is there intact and the capsular space is there. Here too, we can see this. From this picture, we can see this is the treatment at 6 weeks with the positive control drug carbidiol, and it has shown that the drug has caused an inflammation, because the Bowman's capsule here, it has become enlarged and it has enlarged and we cannot be able to see the capsular space. So this is another picture. This is another picture at the 6th week with treatment with tamsulosin at the dose of 12 microgram per kilogram. And we can see the capsular space is well shown. no inflammation, Bowman's capsule has not enlarged. So this is another picture. The capsular space is intact when tamsulosin dose was increased to 40 microgram per kilogram. No any effect. Here at 8 week, this is treated with distilled water. Treatment with distilled water, there is no any effect. Here is another picture. Treatment with solution. In conclusion, based on this result, we can say tamsulosin drug cannot cause any histological problems on the treated rats. It has no any ability to cause histological lesion to